Imagine you wake up in the morning feeling sick, and you simply go to the doctor without worrying about how much it will cost, without thinking about whether your health insurance will cover the expenses, or if you'll end up with a huge bill, like having to pay as much as a brand new compact car. For Americans, it seems like science fiction, something out of a movie. But in Europe, this is normal. It's the standard. First things first, no financial freakout when it comes to going to the doctor. For many Americans, deciding to go to the doctor involves a complete financial breakdown, like figuring out if they can pay their car registration and property taxes. Before making an appointment, you have to check the costs if your health insurance covers the treatment and what your copay will be. Even a routine checkup can be a big expense, which leads many people to put off seeing the doctor until things get really bad, like almost turning into a character on House. In Europe, things are very different. In most countries, doctor visits are covered by the public healthcare system, and when there are costs, they're super low, like buying a roll at the bakery. No one is afraid to go to the doctor because of the price. This lets people see a doctor when they need to, and not just when it's a real emergency, like those crazy cases on ER. This different mindset has a direct impact on public health. Since there are no financial roadblocks to healthcare, Europeans are generally more proactive about their health, like watching what they eat and exercising, almost like they're Olympic athletes. In the United States, the fear of medical costs makes many people avoid routine checkups, which leads to the late diagnosis of illnesses that could have been treated more easily if they had been caught early. Second, no surprise medical bills. One of the biggest fears of every American when they go to the doctor is the bill that comes afterward. It's not uncommon for patients to be treated in the emergency room and weeks later receive a bill for thousands of dollars for procedures they didn't even know they had. The bills can include outrageous prices for basic medical care, costs of out-of-network procedures, and other fees that are hard to understand, a real candid camera surprise. In Europe, this problem doesn't exist. The costs of medical care are transparent and in most cases affordable. If a patient has to pay something, they know it up front and don't have to face the uncertainty of finding an unexpected bill in the mailbox weeks after treatment. It's like reserving a table at a restaurant. You already know what to expect. This also reduces stress for patients who can focus on getting better instead of worrying about how they'll pay for their care. In the United States, many people go into debt because of unexpected medical expenses. This simply doesn't happen in Europe. The certainty of not having financial surprises after a checkup or treatment is a relief that's hard to imagine for those used to the American healthcare system. It's like winning the lottery, only better. Thirdly, healthcare shouldn't depend on your job. One of the most controversial parts of the American healthcare system is how health insurance is tied to employment. This means losing your job isn't just a financial crisis, it also puts you at risk of losing your health insurance. For many, this is a huge factor when thinking about changing jobs or even starting their own business. It's like the fear of not having enough money for retirement, which stops many from working for themselves. In Europe, things are completely different. Access to healthcare doesn't depend on your job. Citizens and residents have the right to healthcare no matter their work situation. This gives them more stability and peace of mind. It's almost as certain as knowing that stores will be closed on Sundays. This also has a positive impact on the economy as people can make career choices based on their interests and skills instead of being stuck in a job they don't like just for the health insurance. They can grow freely, almost like during the Carnival of Venice. Having access to healthcare regardless of employment also means people have more freedom to recover if they get sick or injured. In the United States, someone who loses their job due to health issues can end up in a terrible situation with no income and no coverage for their illness. In Europe, this scenario is practically unthinkable as public healthcare systems protect citizens in any circumstance. Fourth point, ambulances won't break the bank. In the United States, the cost of an ambulance can be outrageous. It's common to hear stories of people avoiding calling 911 for fear of getting a bill for over $1,000 just for the ride to the hospital. This leads to crazy situations like people choosing to take a taxi, an Uber, or even driving themselves to the hospital, even in serious cases. Seems like something out of a movie, right? In Europe, ambulances are an accessible service and don't represent a financial burden for patients. In most countries, emergency services are fully or partially covered by the public health system. So, people can call for help without worrying about the cost. This difference not only improves the quality of medical care, but also saves lives. In a system where ambulances are free or low cost, people don't hesitate to call for help when they need it. This reduces the death rate in emergency situations. 5. Affordable medications. The price of medications in the United States is a serious problem that affects millions of people. Many American families have to choose between paying their bills or buying the medicine they need. And sadly, in some cases, people give up on getting treatment altogether because they can't afford it. Essential medications like insulin have outrageous prices, putting the lives of those who depend on them at risk. It's like you have to earn an entire paycheck just to buy insulin, you know? In Europe, medication prices are regulated to make them affordable for everyone. Governments negotiate directly with pharmaceutical companies to keep prices low. This way, everyone can afford the treatment they need without any problems. Think about the National Health Service, which makes things much simpler. Thanks to this system, Europeans have better access to the medications they need, and, as a result, a better quality of life. In the United States, on the other hand, the high cost of medication is a constant obstacle for those who need long-term care. 6. Access to specialists. In the United States, getting an appointment with a specialist can be tricky and expensive. Often you need a referral from your family doctor, which makes the process longer and can mean patients wait months to be seen. It's like trying to book a visit to the post office in the middle of summer, only worse, much worse. In Europe, seeing a specialist is much simpler, and in many cases, patients can see them directly without a referral. Also, the cost of seeing a specialist is usually much lower, allowing more people to get the care they need without long waits or crazy costs. This easier access leads to better medical outcomes because patients get diagnoses and treatment faster. In the United States, many illnesses get worse because patients wait too long to see a specialist due to roadblocks in the healthcare system. Number 7. Prevention is a priority, not a luxury. In the United States, medical prevention isn't always a top priority, especially because many people avoid going to the doctor as much as possible. Annual checkups and routine exams can seem like unnecessary expenses when healthcare costs are high, and for those without health insurance, these services are often out of reach. I mean, imagine paying a fortune to find out everything's okay, right? Better to wait until things get worse. Sadly, that's the reality for many. It's kind of like burying your head in the sand, isn't it? Better not to think about it. In Europe, however, prevention is a fundamental part of the healthcare system. Governments invest in public health campaigns to raise awareness about the importance of regular checkups, vaccinations, and a healthy lifestyle, kind of like the awareness campaigns we see in Italy too. Plus, most countries offer free or affordable preventative screenings, allowing people to get checked regularly without worrying about the cost, like going to the pharmacy to get your blood pressure checked, for example. This approach has a significant impact on the health of the population. When preventative screenings are accessible, diseases are diagnosed early and can be treated before they become serious problems. In the United States, on the other hand, the high cost of healthcare forces many people to ignore early symptoms and only seek help when the situation gets worse, leading to more invasive and expensive treatments. In short, it's like we say, a stitch in time saves 9. 8. Doctors don't try to sell you anything. In the United States, many people feel that medical visits are influenced by financial interests. Doctors might recommend unnecessary treatments, name-brand drugs instead of generics, or expensive therapies. Because the healthcare system works like a profit-driven industry, kind of like the car industry in the 60s. In some cases, even hospitals have financial incentives to perform more tests or procedures than necessary. In Europe, the situation is very different. Doctors don't have financial incentives to sell treatments or additional tests. Their work is focused on the patient's health and not on maximizing profits. This completely changes the doctor-patient relationship because patients can trust that the advice they receive is based on their well-being and not on commercial interests. Like a chat with your trusted family doctor. Many Americans who see a doctor in Europe for the first time are surprised by the length and detail of the conversations. Doctors usually take time to learn about the patient's habits and medical history instead of just giving a quick diagnosis and prescribing expensive medications. Number 9. Practically no stress from healthcare. Living in the United States means living with the constant worry of medical costs. Even with health insurance, a serious illness can cause debt that lasts for years, even a lifetime, like a sword hanging over your head. Many people avoid going to the doctor for fear of not being able to afford the care or the medicine. This only increases anxiety and daily stress. In Europe, universal access to healthcare eliminates this worry. People don't live with the fear that a medical emergency will ruin their finances. They can focus on their well-being without worrying about how to pay medical bills. A real lifesaver. This peace of mind has a direct impact on quality of life. Mental and emotional health improves when there's no financial stress from illness. It's like a weight off your shoulders. Without financial obstacles, people go to the doctor sooner before problems get worse. This contributes to a healthier population. So, it's not a perfect system, but it works. Even with all the good things about European healthcare, it's not perfect. Some countries have problems like long waiting lists for certain procedures, or they need to get better at managing resources. The big difference, though, is that even with these problems, everyone can still get medical care. In the United States, healthcare is seen as a privilege, tied to how much money you have. In Europe, it's a basic right. It means everyone gets medical care no matter how much money they make, kind of like the National Health Service, get it? This approach not only makes people healthier, but it also makes things more fair and lets people live with less worry. Think about how much better life is. For many Americans who have seen the European healthcare system, the difference is huge. It's not just about lower prices or easier access to doctors, but a completely different way of thinking about how to take care of a society's health. After hearing these differences, the question is unavoidable. Why does the healthcare system in the United States still work this way? No system is perfect, and even Europe faces challenges in healthcare. But the idea that health is a right and not a luxury fundamentally changes how people live and are cared for. If you have had experiences with the healthcare system of other countries, tell us about it in the comments. What do you think about these differences? Do you think the United States could learn something from Europe? Maybe by taking inspiration from our National Health Service. If this video made you think, don't forget to subscribe to the channel and share it with someone who should see it. See you in the next video. Stay well.